Hello and welcome to JAMA Network Open Conversations. I'm Angel Desai, Associate Editor for JAMA Network Open. Today we are speaking with Dr. Bryan Sexton about well-being outcomes of healthcare workers after a 5-hour continuing education intervention. Welcome. To begin, can you please introduce yourself?
Thank you. I'm Bryan Sexton. I'm a psychologist and a psychometrician at the Department of Psychiatry at Duke. I'm also the director of the Duke Center for the Advancement of Wellbeing Science, which is where we create and validate metrics and interventions to assess and to improve healthcare worker well-being.
This study, I think, touches on a really pervasive and important topic among healthcare workers, and certainly within a really critical time frame during the COVID-19 pandemic. And I really enjoyed reading this. Can you just start by giving us a little bit of background about this study?
Sure. In a prior JAMA Network Open article that followed 30,000 healthcare workers over 3 years, we showed a dramatic increase in emotional exhaustion, which is how we measure burnout, between 2019 and 2022. And now that was the prevalence and the severity of the problem. And it mapped onto what other well-being researchers like Tate Shanafeld and Colin West have found in their longitudinal studies of physicians. Now, going back to 2014, Duke and Stanford, with a colleague there, Jochen Profit, we worked to validate a series of these bite-sized well-being interventions that we borrowed from positive psychology. And we used NIH funding, and we published a couple of randomized controlled trials showing that we can cause well-being to improve in busy, tired healthcare workers. Now, those randomized controlled trials used a microdosing technique that helped healthcare workers cultivate brief but meaningful positive emotions. And as it turns out, access to positive emotions is essential for recovering from emotional upheavals. But there's a really interesting caveat. It's not the magnitude of the positive emotion, it's the frequency that matters. So it's not how hopeful you are or how funny something is or how amazing something is. It's how frequently you feel a little bit of hope or a little bit of gratitude or a little bit of awe and wonder. And that makes a huge difference in your well-being. And when we learned that, we revamped all of our studies. And that's what led to the present study, which was a new delivery mechanism.
This is fantastic. And you've touched a bit about this already, but I think the background here is really important. You know, you mentioned in the study that there are many well-intentioned interventions that have been proposed to try and improve healthcare worker well-being. Can you speak briefly about how this intervention well-being is different or, is building upon some of that which came before?
Yeah. So in previous studies, we used interventions that would help individuals cultivate positive emotions by sending them a text message. And these were 10 to 28 text messages over a period of time. And each text message would have a little activity that we would ask you to do to cultivate a positive emotion. Well, when COVID hit and we were all asked to convert everything to Zoom, we said, well, why don't we take these things that we were doing through text messages and just bake it into continuing education? So that instead of getting 28 text messages over 28 days, now you can just do an hour of continuing education, like a CME or CEU credit, and 10 minutes of that hour is cultivating these little positive emotions. So we baked it into an activity that they're doing anyway, which just made it more feasible and accessible. Thus, Wellbe was born.
Great. Can you give us a brief overview about what you did in the study?
Yes, I think that one of the things that made this different from our previous work and from other studies is we used what's called a raft format. And this was not our idea. This was kind of generated from feedback from healthcare worker participants in our studies. And raft stands for Research, Assessment, Feedback, and Tool. So in each of these hours of continuing education, we present the research, like here's the evidence, right? And we give people all the links, and so they can kind of follow up and get all the data on their own. If they don't take our word for it, here's the data. The assessment, the A, is where we give them like a 5-question metric of emotional exhaustion. And then the F, the feedback, is we give them feedback on their emotional exhaustion relative to hundreds of thousands of other healthcare workers. So you get you kind of step on the scale and you get to see your numbers. And then the T in RAFT is for tool. So once we've got you assessed and fed back, now you're kind of primed. And you're like, well, I got to do something about this. And that's when we give the tool. And that research, assessment, feedback, tool technique happens in every single one of the 5 hours. And I think it's fair to say that's what really helped us with retention. It's what helped us with engagement. And I think it's a big part of what made this work.
Can you specifically highlight the 4 domain measures in the study?
Yes. So the four domain measures were emotional exhaustion. That's the most common way of measuring burnout in healthcare workers and outside of healthcare as well. The other three metrics were work-life balance, measured using a work-life integration climate scale, emotional recovery, so how well do you kind of bounce back after an upheaval, and emotional thriving, which is kind of how well are you flourishing. And those four metrics together, all of them were improved by the study.
Yeah, makes a lot of sense. So this was a randomized control trial. Can you tell us a little bit about just the setup of the trial itself?
So it was all web-based. Anyone who is a healthcare worker, 18 years old or older, is welcome to do it. It's still open now if anybody wants to try it out. It's not a randomized controlled trial anymore. It's an observational study. But the way it works is you go to a link and you enroll. It's very quick enrollment. And when you enroll, we give you a taste of what that feedback looks like, because we ask you four questions, and it happens to be about like your emotional recovery. How well do you bounce back after an upheaval? And then we give you feedback on the recovery. And we say, like, if you want to see more of this kind of assessment and feedback, come try this trial. So even when they enroll, they get a taste of what that's going to be like. And so there's individual level randomization. So every person who comes in is randomized to either start on the first of the month or start on the 8th of the month. Then the trial ensues. It's all done now through recordings. So it's on demand. If you want to start on a Wednesday, you can start on a Wednesday. When we ran the trial initially, it happened in cohorts. So you would enroll, and when the next cohort started, that's when you would start. But now it's all kind of on demand.
That's great. And what were the main results of the trial?
So all four outcomes improved significantly. The two that improved the most were what we were hoping, which is emotional exhaustion. But that's the big, when everyone talks about burnout, they're usually talking about emotional exhaustion. And the other one was emotional recovery, which is, bouncing back. So the way I like to think of emotional exhaustion personally is it's kind of like, how big is your battery? And so if you're really exhausted, if you're really emotionally exhausted, your battery is pretty small and it depletes pretty quickly. And emotional recovery is how quickly can you recharge that battery? So there are two different aspects of your well-being. And we improved both of those. So your capacity for your battery improves, and the speed with which you can recharge that battery improve as a function of the intervention.
This was a really interesting read, as I mentioned. And, I think it's important to note the trial assessed short-term outcomes at 8 days, I believe. And there's a line in the discussion that I loved following the intervention, which was they, meaning healthcare workers, didn't simply recharge their batteries. It appears they upgraded the capacity of their batteries for future charging, which I think you've also alluded to. I think is a really important point when thinking about improving well-being. And I wonder if you could just talk a little bit about this concept in the context of achieving sustainable gains over the long term without going too far outside of the scope of the study, of course.
Yes, that's such a good question. When we've done previous work and others have done previous work, we look at kind of 1 month and 6 month and 12 months post. At the time that we conducted this current study, it was right on the heels of Omicron, and there wasn't a lot of appetite for people to commit to long-term studies. So one of the ways that we made it more attractive to healthcare workers was we said, listen, we're not asking you to commit to something for a year. Give us 8 days. Just give us 8 days. And then you won't hear from us anymore. And that really helped during a critical time for healthcare worker wherewithal. That helped with recruitment and it helped with retainment. But it limited our ability to have longer term outcomes. Now, we have previous studies where we've used similar microdosing techniques for positive emotions, and we've done 1 month and 6 month and 12 month posts, and they've worked. In fact, Jochen Profit and I just published a 1-year follow-up to one of our previous randomized control trials, and we showed not only did you sustain the gains, it continued to improve at the 12-month mark, which is, that's exciting. But we don't have that data for the current trial. And it was just a function of where we were in a global health crisis at the time that we conducted it.
That makes sense. Do you think there are ways sort of taking this trial and all of the knowledge that has been built in this space for healthcare systems to be able to apply some of these tools for their healthcare workers to try to mitigate emotional exhaustion and burnout?
Yeah. So number one, it's grant funded, so it's free to anybody. It's available right now for anybody who wants to try it. And it could be easily added to anyone's arsenal because it's just voluntary. And you can do it alone. We've had entire work settings and departments and divisions do it at the same time so they can talk to each other about it as they're going through it. So it can be an individual intervention. It can be a group level intervention. And it's certainly, because it's continuing education and it's on demand, the recordings that you're provided, You have a year to watch them. You don't have to watch them within 24 hours. And that makes it feasible for people who can't do it now, but maybe they can do it next week, kind of a thing. Now, that said, no one study like this is going to be the magic wand that solves the burnout crisis that we have in healthcare right now. It can certainly, though, be an arrow in anyone's quiver as they're going forward.
Any plans for a future follow-up or additional studies?
Yes, this is the first step in building capacity and infrastructure for healthcare worker well-being. Many of the participants that finish these 5 hours, they want to continue with more of these bite-sized strategies. They want to learn how to use well-being metrics and share locally with their colleagues. And to this end, we created a well-being ambassador training program using a 10,000-line Zoom through Duke to prepare the next generation of well-being leaders. WellBe is the first 5 hours of that training, but there are 12 to 17 additional hours that folks use, all with continuing education credits and additional well-being arrows for their quivers. Ultimately, there's not one single solution for the well-being problem in healthcare, so we believe that building capacity through these local well-being champions who adapt evidence-based resources to their local needs is the best path forward. It's an exciting time, so watch this space.
Before we wrap up, are there any final thoughts regarding this topic or anything we didn't cover?
I'm really appreciative of the Michigan Health and Hospital Association, who we partnered with to do the recruiting for this at a time when recruitment was extraordinarily difficult. That was very powerful in helping us during a difficult time to get people to do anything for well-being. And just as a reminder, this is free and it's available for anybody who wants to do it right now.
Thank you so much for speaking with me today about this very pertinent, relevant topic. I'm Dr. Angel Desai and have been speaking with Dr. Bryan Sexton about well-being outcomes of healthcare workers after a 5-hour continuing education intervention. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. This episode was produced by Daniel Musisi at the JAMA Network. Thanks for listening.